Welcome to the Nothing About Us Without Us Drivers Speak conference. Our conference is strategically scheduled to coincide with World Mental Health Awareness Day on October 10th. This global event emphasizes the importance of mental health and well-being, making our conference a timely and relevant initiative. By focusing on mental health impacts of child psychological abuse, we aim to foster greater awareness and understanding among professionals, survivors, and the general public. True healing begins when we listen to the silence of those who have endured the deepest pain. Together, we transform their whispers into a powerful call for change.
Okay, well, welcome everybody who's come and joining us today or tonight, actually, here in Australia, and today over there in America. Welcome to the first ever international adult child survivor of child psychological abuse related to parental alienation conference, also known as the NAUWOU conference, Nothing About Us Without Us. So it's an incredible honor to actually be here today as we gather for this groundbreaking event, an event that brings survivors together to share their stories, their strengths, and their hope. Each of us carries a unique journey, and today we come together as a community, united in our shared experience and in our commitment to making a difference in the world of the children. Before we move forward, I wanted to take a moment to acknowledge the person who made all of this possible, my beloved best friend, Dawn McCarty. Dawn's ideas, vision, and sheer determination have been the driving force behind this conference. From the very first phone call she made to me back in January, running this idea past me, to the countless daily brainstorming ideas and sessions we had together, we're finally here. Remarkably, even a hurricane hasn't stopped us. Despite being hit head-on by Hurricane Milton today in Florida, Dawn is still with us, even though she can't actually speak at this point because her devices aren't working properly. She's still here, fully present and committed, and her resilience is an inspiration to us all. And her dedication over this past year, day in, day out, has brought this event to life in a way that the world has never seen before. Dawn, thank you. Your tireless efforts have created a space for survivors to be heard, to heal, and to advocate for a better future for all of those affected by child psychological abuse related to parental alienation and the children who've also been abducted. As we begin this conference, we are not only sharing our stories, we are reclaiming them. This is about breaking the silence, educating the world, and ensuring that no child now or in the future has to endure the abuse that we have experienced. Today marks the beginning of something truly transformative, and here we are to make an impact. I want to dedicate our conference to the currently alienated and abducted children across the world who cannot speak for themselves. Briefly, I want to introduce you to two alienated children and abducted children, Rian, Tulin, and TJ, and we will be speaking more about these little lost darlings later in the conference. Please light a candle and join us. I'm just quickly going to show you a picture of the children we're dedicating this to. This is Rian. She's been abducted to Poland. And we also have TJ. He's here too. This is little TJ. This is for you, our little darlings, our little lost darlings, but we'll talk more of them about them later. Thank you all for being part of this historic moment. Let's make today the beginning of change, healing, and hope. Thank you.
Thank you. Thank you so much.
Thank you, Dr. Alyse. This is Jeannie Russo, and I want to just step in real quickly before we launch this incredible conference. I want to send a special shout out to Dawn McCarty, especially. She is a dear and just the brains behind this as well. And as you, Dr. Alyse, there is just so much love that went into this. What I want to ask is, Dr. Alyse, would it be okay, and Marty, if we just give a moment of silence to acknowledge right now, people are facing life and death situations. This is a serious time. We take a moment to acknowledge this and thank those who are on this conference call right now, whether or not they're experiencing family or someone that is trying to survive at this moment. We truly have our thoughts and prayers. And I just want to share, I mean, I definitely have my candle here for the conference, for the children. But if we could, Marty, give us one moment of silence. Thank you, everyone.
Jeannie, I know Danica's caught up in the storm. She was going to MC for us for the conference, and she's been hit very hard down where she is. So we're sending her love and prayers as well.
Oh, thank you for that.
Absolutely.
And we want to thank a few people before we even begin.
Hey, everybody, this is Dawn McCarty. I wanted to step in here for a minute and to thank with such gratitude those that stepped in to help make sure that the conference went on, even while I was dealing with a hurricane heading right for the Tampa Bay area where I live. So I want to send out a special thank you to Patricia Frudenberg, who is the principal owner of Missugram, a social network app for grief resilience. And also a very special thank you to Master Chef Marty Mongiello for coming to the rescue to help with the production side of the conference. It's such amazing friends like that that come together to make sure that we didn't skip a beat, even though I couldn't be here. I know the conference is in marvelous hands. And then also I wanted to thank Jeannie Russo, who has come in to help make sure everything runs smoothly. They have come to the rescue so that everything goes on as planned, and I couldn't be more confident that the conference would be an amazing success. Thank you all so much from the bottom of my heart.
And Dr. Alyse, could you share just a little bit about mental health and wellness?
Extremely important. And I'd also like to point out that we would really love World Mental Health Day on October the 10th to also be known as Child Psychological Abuse Day, because it doesn't exist at the moment, and we want all the children who are experiencing any kind of psychological abuse and abduction, parental alienation, to be recognized and seen, and today and tonight we are their voices, but hopefully not for long.
We want to also recognize, and maybe Dr. Alyse, you could speak to this, any attorney, professional individual, this is giving us the ability to provide you with expert knowledge. This is a conference that actually provides credits, 15 credits. So the credits, if you're, I believe Dawn had shared with us, if it's in Florida, we already have acknowledgement that those credits are accepted.
In order to qualify for the continuing legal education or the continuing education units, depending on what you call them in your industry, you must watch the entire 2-day conference, as well as watch the Erasing Family documentary film, which you can watch for free on YouTube, Tubi, or if you go to erasingfamily.org, you can also watch it there for free as well. So this conference has been accredited by the Florida Bar. They have assigned 15 continuing legal education units, 7 of which count towards your mental health criteria. So that means the remaining 8 count towards your general legal and ethics, because combination in there. So if you need to claim CLEs or CEUs for the year, then this conference can actually help accommodate at least half of what the criteria is. So if you self-report and you're not a Florida attorney, that's fine, as long as you're going to have to check with your industry, your state, your regulatory bodies, your management, and determine how you can do a self-report. Many people are able to claim these credits regardless of where they are around the world. So check into it to see if you can also claim the 15 CLEs or CEUs. Once you have completed watching the entire 2-day conference videos and the Erasing Family documentary film, send an email to info@thriverspeak.com and we will send you a certificate of course completion.
If you are in another area of the United States, this is giving you an opportunity. There is a way, I believe, you can reach out to your organization to see if there is some type of reciprocation that can be done so that you can get these credits. Definitely, it's worth it.
Yes. And for those of us who are in the mental health field, just by watching this, well, I know that I can definitely claim credits for speaking. And if I was watching the conference, I have, and every single year with our registration, we have to view a certain amount of mental health videos and conferences, and they all count towards our clinical registration each year. So yeah, we can just ask your management, and yeah, it should be pretty good.
We are blessed to have your knowledge, Dr. Alyse, to bringing this to the forefront. Your studies, you have 2 degrees and 2 doctorate degrees. If you could just touch on those 2 for a moment to share with everyone.
Yeah, so it's a twin PhD study, what I did, and it's called Working with Adult Survivors of Child Psychological Abuse Related to Severe Parental Alienation. So I studied some adult child survivors and what treatment they were given, what worked, what didn't, and why. And then my second PhD study was the mental health practitioners, the best in the world, and what treatment they're currently using with adolescent and adult child survivors of this particular abuse. And I captured all of that research, and I'll be talking about that after we have our special intro from a certain special person who's also my clinical supervisor. I'm proud to say.
Patty's got her background up, looks beautiful. Yeah.
Hey, all right.
Also, we had some greetings from Poland and other people who were on. Welcome and good morning to everybody.
Hello, how are you? Coming in from New York. Nice to be here. I'm really excited to get started. We have amazing speakers, and we have this is really breaking glass ceilings, because we are giving a voice not only to the adult survivors, but we're giving a voice to the children. And I'm excited to start this new wave of not only a world awareness for mental health, but also child psychological abuse. We will now be inviting more of our speakers as panelists, and we're excited to hear them speak. Marty, back to you.
Yeah, I was just going to say, I think the next thing coming up today really is the introduction by Dr. Alyse. And we have a special video, which is an introduction. It was pre-recorded, so that's nice. This is a special Dr. Childress introduction, about 6 minutes long. So we've got that queued up and ready when Dr. Alyse is ready.
I think it's time for the introduction by Dr. Childress, and then I can talk a little bit about my research, which I'm dying to share with everybody. And love that. Thank you so much.
I've got Dr. Childress ready to roll. Without further ado, we do have a special introduction from him today in a pre-recorded speech. And without further ado, Dr. Childress.
Hello, I'm Dr. Childress, and I've been asked to introduce, and I have the great honor of introducing, the first annual conference for the now adult children of child abuse in the family courts. It's quite a long name. It'll shorten over the course of time, I'm sure. But this conference is the voice of the now adult children who have survived the family courts and excessive family conflict in their development. And so this is a wonderful milestone in the development of healing for trauma, for both the parents and the historical trauma, as well as the children going forward, to begin to get the authentic voice of the children returning, even if it's now in the adult survivors of this pathology, the problem. And I would just want to start by noting there's a difference in terminology between mine, which I call them survivors, and their own self-identification as thrivers. And I would support that. I would agree with that. That there's a tremendous potential for the now adult survivors to actually turn this into I wouldn't say a positive necessarily, but thriving in the face of the challenges that they faced. So first off, I want to correct or orient that I am not, or don't see myself as a speaker at this conference. I'm not a participant because I'm not an adult survivor of the family courts. I'm a professional who works in the family courts. So my voice is speaking with the voice of a professional, a psychologist. And that's, while valuable and important, we need to be here because this is child abuse and trauma, that's not the most important voice. The most important voice is that of the child, the authentic voice of the child, and helping the child to adults at whatever phase recover that authentic voice and discover and find that and begin to live into their authenticity, as opposed to the living for another person, satisfying the needs of someone else. To begin with as well, by way of introduction, I want to be very cautious relative to the professionals and the community of the now adult survivors, or the children's voice coming out in that domain, as well as any potential children's voice within the family courts, although I don't expect that until we can protect the children there. But with the now adult voices, one of the problematic issues regarding this pathology is the exploitation of children by the adult, by the parent, to meet the parent's own needs. It's called being used as a regulatory object for the parent to meet the parent's needs. And that's a danger now with the voice of the adult survivors, the adult children coming forward, that there might be a desire from other forces, mental health professionals, parent groups, parents, to once again use that voice to meet some sort of end or goal. And no, that shouldn't be. If the now adult survivors, the thriving survivors of child abuse, if they seek to enter their voice into dialogue and discussion, that's their choice. But we need to be very cautious on the surrounding professionals, parents, and everybody, that it's not coming from us. We can carry our own voice, and we can solve this pathology on our own. We don't need the children to lead us in that process. So with that, with those cautionary statements from my involvement as a professional, I'm honored to provide an introduction as an ally to the community. I'm not within the community, and I don't work in the community, and that's not my role right now. My role is to help the existing children in the family courts and get better quality mental health services into the family courts. But it is a great honor for me to introduce the first annual conference on the voice, the authentic voice of the children from child abuse. So the now adult survivors of child abuse, child psychological abuse.
And coming back to all of you fine people. All right. I just thought that was like, I mean, honestly, the cautionary mantra from him, the abusiveness that has become rampant in the United States over the years, the family court system that has been stretched during the past 30 years beyond understanding, with the docket, to where you're waiting 6 to 8 months. The family courts are so stretched, and then the weaponization of children, it has just been rampant as a tool, as a pawn, as a whip, as a weapon, as a wedge, to make sure that people feel pain, and putting sticks into people's armpits, and twisting it until they scream. I have come to realize in itself is highly abusive of children, who are weaponized. And so I think I'm going to learn a lot myself over the next 2 days when, this book came out and all this conversation on the website about children are not weapons. I know a lot of people are like, what is that all about? Why are they using like that? Children are not weapons. Like, that's kind of dumb. We already know children aren't weapons. Bombs are weapons. Machine guns are weapons, Marty. But I don't get it. And I think people are starting to get it now. The more that we talk and just listening to him. What were your impressions, Jean Marie?
Oh my goodness, he opens up the eyes of society, and on a global basis. It touches upon the need and the underlying issues that are so deep and not spoken of, and or to, that it is bringing an awareness. And that's what this conference is about: opening the eyes, bringing an awareness. Dr. Childress is a flagship with his support of the children, the psychological abuse part of this. Dr. Alyse, can you share how much of a billion-dollar industry is this?
Well, it's an $80 billion industry. High conflict divorce is an $80 billion industry in America per year. That's how much is being made within the family court system around high conflict divorce and children. So we have to have a very, very serious look at this, because we are now the adult children who've been through the systems, and we have a lot to say about this space. And that's what this conference is about. And I want to say to everyone that if you're in high conflict divorce, fighting over children and keeping children from a safe, loving and available other parent, these children grow up and then they come to conferences like this, and then we speak about what has happened. And it's going to be a difficult day when we come and talk to you. I can guarantee it. So I'm going to go and talk about all the research that I've done about this, and but it's very, very, very concerning, and it needs to stop.
Dr. Alyse, it is actually a little bit behind for you to begin. You're scheduled for 8:10 to 9:10 today. Is it okay, Patty and Jean Marie, if we get into her slide? I have her presentation slide ready.
Go ahead.
I've got her
Okay.
introductory slide. Let me put your slide
please.
up so I don't get in trouble from Dawn.
Okay.
This is the introductory slide for Dr. Alyse Price-Tobler. And we'll just pop this up for everybody because I know this is being recorded and used later. And so this will help people watching this seminar maybe 3 years from now.
I am so pleased and excited to announce this. It's been a long time till we get to this particular point, and I'm so excited to be able to bring to the world Dr. Alyse Price-Tobler and everything that she has done for this particular type of child abuse. So without further ado, Dr. Alyse Price-Tobler is a clinical psychotherapist and leading researcher in the field of severe child psychological abuse related to parental alienation and abduction. With over 38 years of experience, she has dedicated her career to understanding and supporting adult survivors of this abuse. Her groundbreaking work continues to shape mental health treatments as an experienced mental health practitioner and academic researcher. She has recently completed twin PhD studies on adult child survivors who have the lived experience of this form of psychological abuse during their developmental years. Their study also focused on mental health practitioners who support these adult survivors and their current treatment approaches. With a keen focus on child abuse, her work aims to understand and address the challenges faced by survivors while developing effective treatment protocols in this area. In her 38 years of frontline experience in mental health and disability work, Dr. Price-Tobler's journey is deeply personal as she is an adult survivor of severe level of this abuse herself. Central to her research is her twin PhD thesis titled Working with Adult Child Survivors of Severe Parental Alienation Abuse, Survivors and Mental Health Practitioners' Perspectives, which delves into the complex challenges regarding current treatments in this field. Dr. Price-Tobler conducted thorough international studies involving interviews with survivors and 10 of the world's foremost expert mental health practitioners specializing in severe child psychological abuse and abduction. These efforts have culminated in developing an innovative, soon-to-be published treatment protocol. She is the co-host of the Humanly Possible channel, which focuses on bringing awareness to child psychological abuse related to parental and family alienation and abduction, and she is the co-founder of the Nothing About Us Without Us Thrivers Speak events conferences. And lastly, Dr. Price-Tobler is currently studying to be a criminal, family, and human rights barrister. Dr. Price-Tobler, welcome to the first ever inaugural conference on child psychological abuse given by adult survivors. This is the first inaugural event of the Nothing About Us Without Us Thrivers Speaks conferences. Dr. Alyse, the floor is yours.
Amazing. Well, okay, perfect. Well, let's begin. Greetings to you all. As you know, I'm Alyse, and I'd like to welcome and thank everyone who's set aside time to come and have a look at my twin PhD thesis presentation today. In particular, I'd also like to welcome my clinical supervisor of the last 3.5 years, Dr. Childress, and anyone watching from their homes or office, and I appreciate that all of you are here today to support my research. My thesis is titled Working with Adult Child Survivors of Child Psychological Abuse Related to Severe Parental Alienation Abuse, Survivors and Mental Health Practitioners' Perspectives. a qualitative study. So I'll be moving through the research over the next 2 days. So I'd like to acknowledge the traditional custodians of the land that my research is built upon. I would also like to pay my respects to the traditional custodians of the land where I live and have written my thesis, the Gundungurra and Tharawal peoples. I pay my respect to their elders, past and present, and emerging worldwide. Please note that serious levels of child abuse are discussed and may upset some viewers. Please speak to someone if you feel upset during or after this presentation. And I'd just like to say, when discussing a phenomenon such as child psychological abuse related to PA involving adult survivors who've been coerced as children to reject a loving parent, some people may see aspects of their own experience, other family members or friends within this presentation. So a little bit about my background. I've worked on the front line in mental health and disabilities for 30 plus years. I'm a practicing clinical psychotherapist, and I currently work daily with adult child survivors and targeted parents of parental alienation in my private practice. I'm also a child abuse and family and domestic violence researcher, as well as having lived experience as a child of severe PA and abduction myself. So I'm currently in the development stage of a treatment protocol that mental health practitioners, known throughout this presentation as MHPs, can utilize when working with adult survivors of child psychological abuse related to severe PA, also known as SPA. As a side note, I do not get paid to create this protocol. I'm doing it because there was never one available to help me. So now I'm creating it myself. So severe PA is the layperson's term for the child's allied parent creating a shared persecutory delusion in the child and false, factitious, artificially created attachment pathology for the secondary gain to the narcissistic, borderline, dark personality parent to manipulate the court decisions regarding child custody and to meet the pathological parent's own emotional and psychological needs. And you can see that is a reference from Dr. Childress. So basically, the final thesis outline listed on the slide are topics that I will cover during this presentation. So what are the 2 studies about? What are the aims and objectives? What were the research questions and how did they evolve? What was the research gap? What was the research issue? How were these studies designed? What was the rationale and significance of these studies? What are the findings from both studies? What biases existed in the research, and how can the findings be put into practice? What were the limitations and shortcomings, and how has the research contributed to current thinking in the PA field, followed by conclusions and references. So how did the findings relate to the existing literature? What are the 2 studies about? So this is the first time in the world that 2 studies like this have ever been performed. These studies present new insights into the perspectives of adult child survivors who've experienced severe levels of PA and their mental health practitioners who need to address the complex challenges of SPA support and treatment. So PA is the term used to describe the demise of a previously normal, healthy parent-child relationship during separation, divorce, and custody cases. PA occurs when one parent, the alienating parent, also known as the pathogenic parent, successfully manipulates the child to turn against the other parent, the targeted parent. This process involves the alienating parent teaching the shared child to fear the targeted parent so that the child will reject and avoid contact with the targeted parent. Now, the targeted or pathogenic parent is described as a parent who's been alienated from a child and whose relationship with that child has been interfered with, undermined, damaged, or disrupted without valid reason or justification. Targeted parents can be either men or women, and SPA occurs when the targeted parent or ex-partner poisons the child against them by making negative comments and creating false memories causing the child to emotionally cut off the targeted parent altogether despite a previously strong parent-child bond. Now, keep in mind, I'm talking about the severe level. So there are three types of alienating or pathogenic parents: naive, active, and obsessive. So naive alienators acknowledge the value of the children's relationship with their other parent, but occasionally say or act to alienate them. Active alienators fear the targeted parent and teach the child to reject and avoid contact with them. Research on what we call obsessed alienators suggests that these parents may present with personality disorders, example, borderline, narcissism, psychopathy, a paranoid orientation to interactions with others, severe cognitive distortions, such as holding an unwavering belief that the targeted parent is dangerous, and an unhealthy, enmeshed relationship with their family of origin. Adult child survivors in these studies have experienced a parent who is characterized as engaging in severe levels of alienating behaviors. In many cases, children of SPA may develop and keep paranoid fantasies well into adulthood that align with the severely alienating parent's beliefs. These fantasies can involve scenarios such as abduction or murder of the child. SPA involves serious levels of child psychological abuse with consequences potentially more damaging than physical or sexual abuse, with shared correlations to depression, anxiety, addictions, poor relationships, and suicide for survivors. So this thesis contains a two-part study. Study 1 aimed to investigate the perspectives of the adult survivors of SPA who have accessed mental health practitioners to help and support their abuse recovery. Study 1 analysed the survivors' therapeutic experiences and uncovered their unique insights into the effectiveness of the different methods and treatments that they have experienced. Study 2 aimed to investigate the perspectives of specialist MHPs who work directly with survivors, because previous research reports that MHPs are generally unaware of the complex trauma the survivors have been exposed to, nor are they knowledgeable about working with them. So furthermore, there are no recommendations for best practices, and there is an absence of clear published guidelines for practitioners who work with this vulnerable population. So what was the research gap from the extended literature research review? So the extended lit review that I did for this study identified gaps in the information on adult survivors' long-term physical and mental health challenges and prospects. Another gap identified was MHPs are not receiving the complex trauma training they need. For example, the American Psychological Association that sampled practicing generalist psychologists noted that trauma psychology is not part of the standard curriculum within graduate level education. However, generalist level psychologists with no specialized training for dealing with trauma survivors treated this cohort at an average of 16.9 hours per month. So MHPs who work with adult survivors of trauma need to have in-depth knowledge of the effects and symptoms of maltreatment, including the neurobiological impact, the cycles of violence and trauma, and the different pathways to disorganized attachment. This gap also identified that generalized complex trauma training needs to include a new framework for MHPs working with survivors. The literature review also identified a large gap regarding, sorry, just go back one. Sorry, we've jumped to the next one. Anyway, in summary, the main research issue is that adult survivors are not being recognized as having complex trauma, which is insane in my world, but not surprising, because as an adult child myself, sitting in front of a lot of psychologists over the years, they did not pick up what was going on with me. It's hence another reason why I decided to do this research and write up the treatment protocol. For example, even though the amount of scientific literature on trauma studies is growing exponentially, most practitioners only have a cursory knowledge regarding treatment for survivors. Treating adult trauma survivors is reported to have topical, relational, and risk management challenges with a higher level of complexity than in populations requiring less complex treatment. Consequently, this can confound the therapist. The MHP can become overwhelmed and experience vicarious trauma, with an added concern that the client may also become re-traumatized. Basically, survivors and practitioners are not on the same page. Which leads us to the next quote, which links directly to what my research is focusing on: the long-term effects of severe level psychological child abuse on adult child survivors. Child abuse is a major public health concern and a strong predictor of adult psychopathology. Now have a little think about that for just a moment. Now I'm going to discuss the design of my research. So those of you who are academic may be interested in how I actually designed the studies. So these studies employed a research methodology that focused on qualitative analysis, rooted in the theoretical framework of social constructionism. The data was gathered through qualitative surveys, semi-structured interviews, and thematic examination. Additionally, sensitive research methods and approaches were applied to consider potential behavioral and emotional trauma experienced by a disadvantaged subgroup within the community. In the context of social work, contemporary trauma theory was adopted as the foundational basis for trauma-informed care. Recognizing the significance of co-occurring trauma is essential for ensuring comprehensive and informed approaches to address trauma-related issues. Adopting CTT signifies a shift in how MHPs perceive and treat trauma survivors. So phase one of the research design began with recording my research experiences in my reflective journal using audio and written methods. I did this to counteract any potential bias. It also allowed me to clarify the data analysis and interpretation on a deeper level. This was followed by phases 1 and 2, while I kept in mind the two aforementioned aims of the study. Phase 1 started with the recruitment of 11 adult survivors, and then another 10 world-leading mental health practitioners who actually every single day at different points came across adult child survivors and were treating them. They were the best in the world. So this totaled 21 participants across 2 separate studies through the distribution of an expression of interest flyers. So qualifying questions for survivors were combined with the Baker Strategy Questionnaire, which was suggested to me by one of my supervisors, and the 3 different explanatory levels of PA were sent out to survivors to assess their eligibility. So basically, they were asked where they thought they sat, whether it was mild, moderate, or severe. They had to be severe level and identify as being in severe level to make it into my study. Survivors needed to score mostly 4s, the highest level on the questionnaire, to be eligible and identify personally. So qualifying questions for MHPs were also sent out to professionals interested in joining the study. Further information regarding the study requirements and consent forms were then sent out to all approved applicants within 24 hours. As you can see, there's a lot goes into the design of PhDs. So this is just a little bit about the background of what we have to do to be able to do these studies. So in the study's second phase, interview questions were administered to both cohorts. Like the first phase, data collection was followed by secure storage, and the final phase of the study involved data analysis, which included coding and comparing the data collected from both cohorts. In vivo software was employed for this analytical process. Particular attention was paid to identifying gaps, similarities, differences, and factors relating to risks and protection. This comprehensive analysis aimed to provide a nuanced, holistic understanding of the topic, offering valuable insights and identified potential areas for intervention or support for future research. The independent variable for survivors was measured, and which assessed whether the survivor had experienced severe levels of manipulation by their alienating parent and self-identified. For MHPs, the independent variable was that they needed to have a bachelor's degree or above in psychology and needed to be working with adult survivors of severe level PA. The dependent variables related to adult survivors pertained to the mental health outcomes, measuring the impact of traditional therapeutic treatments on survivors' mental health. The dependent variables related to MHPs were the therapeutic approaches, examining the various therapeutic techniques and approaches used by MHPs in the work with survivors. These variables provided a comprehensive framework for studying the experiences and outcomes of adult survivors of SPA. By examining these aspects, future researchers can gain insights into the long-term impact of parental alienation and potential avenues for support and intervention for survivors. So generalizability is something that we need to look at when we're studying and creating data for PhDs. So these studies assess generalizability by considering the characteristics of the survivors and MHPs sampled, by ensuring that the sample was intentional and reflective of the broader interest of the population. Additionally, any limitations regarding sample size and demographic representation were acknowledged. To enhance generalizability, I suggested that the clinical trials include a more diverse range of participants representing a broader spectrum of experience and backgrounds. To assess generalizability across different contexts, these studies could have included comparative groups, such as survivors who did not receive mental health support or practitioners from different regions or practice settings. So validating the survey data collection methods was crucial. This was achieved by aligning questions with research aims and using thematic analysis to identify and encode themes and patterns within the data. So what I might do, I might just move along a little bit here. So this just talks about the evolution, the rationale and significance of the studies. So we might just pop past that.
I think that's good too, because you have plenty of time looking forward, just looking into the future, since the next guest had to go to the hospital.
Okay.
So we do have plenty of time for you to take your time. Yeah.
Oh, thank you, Marty.
Yeah.
So what is the rationale and significance of these studies? So data on the survivors and their mental health practitioners was collected, compared and analysed for the first time in SPA research, aiming to bridge the gap, the therapeutic divide, and focus on collaborative goals. Now, these study results have been used to be disseminated to benefit both PA researchers and mental health practitioners to better understand mental health solutions for the survivors. So the studies filled a significant gap in the existing literature by providing a foundational platform to develop a treatment protocol. So furthermore, the study's results have the potential to help recognise and mitigate vicarious trauma amongst MHPs, which could lead to reduced attrition rates and greater cohesion within the field. So we've got a big problem here because the mental health practitioners are experiencing a lot of vicarious trauma and a lack of training. So we've got a lot of adult child survivors sitting in front of mental health practitioners, but there's a huge miss going on here. And this was very clear in my studies. So now we move on to the significant clinical findings. So this blew my mind. And this was also coming off the back of some of Dr. Childress's research. And it's only because I read his book, known as Foundations, and I found one single line in here that talked about a phobia amongst young children that I actually realized that I'd found another phobia. So within study one, I discovered a significant clinical finding by way of a new phobia among the cohort whose alienating parent had abducted them away from the targeted parent under the age of 8. I have called it the specific phobia SPA and abduction anxiety variant. So these studies' results revealed that SPA survivors who'd been abducted had experienced a different response than the children previously described in the research who were over 8 and had not been abducted. For example, previous research refers to children of PA as having a campaign of denigration towards their targeted parent. And then they said that these children have a haughty and arrogant attitude combined with weak, frivolous excuses as to why they don't want to see the targeted parent. And that's true in some of the cohort. But in contrast, the adult survivors impacted by the new variant completely disagree with the previous research, stating that they would never have spoken to their targeted parent like that because they were too terrified to speak, due to believing the shared delusion they were experiencing with their alienating parent, which sometimes involved threats of being abducted or killed if they spoke up. So that's a new variant that we've found. So I also stumbled across another significant clinical finding, which is very concerning, and I put this in here because I want the doctors out there who study cancer and autoimmune diseases, when adult child survivors sit in front of them, I want them to be looking for this as well, not just treating the depression or the anxiety or whatever it is that the adult survivors show up with, and adolescent, I should add. So a second significant clinical finding involving autoimmune diseases and cancer emerged while I investigated both cohorts' anomalous medical and health conditions data. Firstly, I discovered 28 new health conditions which differed from previous research describing 13 health challenges survivors might develop. This word cloud shows some of these conditions. For example, survivors reported developing Hashimoto's disease, ulcerative colitis, chronic fatigue, chronic inflammation, HDL cholesterol, adrenal fatigue, prediabetes, irritable bowel syndrome, and a lot more. Secondly, I discovered that concerningly, I want you to listen to this part. 24 out of the 28 conditions were identified as autoimmune diseases or had links associated with autoimmune diseases. So upon further investigation, I discovered that 22 of these autoimmune diseases were reported as having the potential to escalate to cancer. Thirdly, 7 confirmed cancer conditions were recorded within the mental health practitioner data. When I analysed the data, one MHP reported that 5 spa professionals at their place of work had cancer, which they believe related to working in the PA field and in family court. And another one, equaling 6, was experiencing aggressive leukemia. However, I do acknowledge that this figure is speculative. Now, when I combined the previous research results with these studies, I discovered that both study cohorts may be susceptible to 39 autoimmune diseases and 35 different types of cancers. Now, I'm putting this out into the world because I want someone else to pick up this research from where I have noticed this. So this came through in my anomalous data. I wasn't looking for this. This came through because I was reading all of the other data that I had collected within the research and in the interviews. So from the data analyzed in the results, breast cancer was the most frequently mentioned condition. Followed closely as the second most commonly mentioned were colon cancer, non-Hodgkin's lymphoma, lung cancer, leukemia, and skin cancer. Each were mentioned 3 times. Liver cancer was reported twice, while endometrial cancer, bowel cancer, urogenital cancer, and Hodgkin's lymphoma were mentioned twice. So glioblastoma, digestive organs cancer, hematologic cancer, prostate cancer, cervical, vaginal, vulva, anal, penile, hepatocellular carcinoma, which is liver cancer, and chronic lymphocytic leukemia were mentioned once. There's a whole load of cancers. I won't go into all of them because there's so many. Once we saw this coming through in the data, we were very, very surprised. So further findings of the survivor cohort included, in the negative results, 10 adult participants recorded 48 negative experiences regarding sessions with their mental health practitioners. 48 of them. 50% of the survivors feel psychologically unsafe when they're in sessions with mental health practitioners. Many of the survivors use the same techniques to regulate their mental health practitioners as they do with their alienating parent, which I thought was really interesting. Survivors teach their MHPs insider PA knowledge to keep them interested so that they don't leave or refer them. So we've got a cohort of adult child survivors teaching mental health practitioners knowledge about PA to keep them interested so that they don't leave or refer them. This is how on the edge this population is. So survivors reported 41 treatments that were administered by mental health practitioners to them for their symptoms of SPA. Like 41 different treatments. For example, this is what some of the mental health practitioners did with the survivors. They did massage therapy, grief therapy, reunification therapy, tapping, family therapy, collating art and craft, journaling, neurolinguistic programming, timestamp therapy, inner child therapy, cognitive behavior therapy, mirror work therapy, self-talk therapy, de-alienation programming, life and relationship coaching, Reiki, wrapping your body mentally in colors. These were all. So I just want to stop for one sec and say that the adult child survivors that I interviewed were not the patients of the mental health practitioners. The mental health practitioners that I interviewed were a lot of them were not doing any of this stuff. So there's a lot of this was coming from practitioners who weren't understanding really what, and they were doing their best, I'm sure. And it's just what this tells us is they're all over the place because there is no treatment protocol to follow. As a mental health practitioner, we want to follow treatment protocols and move them around a little bit and tailor them to the person that we're working with. But this was just telling us that they're just everywhere. So on a positive note, yay, positive, the study revealed that among the survivors, there are actually 10 individuals who currently hold 17 university degrees, and there are 3 individuals who are in the process of earning their university degrees. These findings offer a sense of optimism to survivors who have faced educational challenges due to SPA factors. This builds on earlier research which reported that children of PA have lower academic achievement. My mind boggles when I hear that and I look at the results that came out of here. So additionally, the survivors reported having very high levels of health literacy due to self-education to counteract the lack of knowledge among the mental health practitioners. So, and survivors actually offered 69 ideas, topics, and psychoeducation suggestions for mental health practitioners to consider regarding treatment for them. For example, they wanted domestic violence support. They wanted to have clear goals. They wanted help with brainwashing and gaslighting from the alienating parent. They wanted help with reframing of stories and boundary setting with the alienating parent. So continuing with the survivor results, this slide has a trigger warning, okay? So adult survivors' perspectives of suicide, threats of killing and being killed, false allegations, and abduction were also captured within my research. The findings of the studies revealed that 30% of the survivors identified that they had thought about and planned to die by suicide. However, they stopped before completion. And 20% of survivors feel that they provide ongoing support to their siblings to prevent them from dying by suicide due to severe levels of PA. 20% of survivors were exposed to stories of killing people or being killed themselves. 20% of the survivors also planned to kill their alienating parent and or their step-parent. The methods chosen were shooting and trigger warning, cutting them up with a machete. That was captured in my research. Data reported that the MHPs validated the data collected from some survivors regarding filicide and homicide reports. For example, their clients have experienced threats of being killed, seen their siblings or parents killed, or just escaped being killed themselves. That came from the mental health practitioners and from the stories that they were being told by the adult child survivors, just to be clear. So their stories were validated. Many survivors reported having their targeted parent being accused of false allegations in court. Now, this is really critical because the amount of false allegations I hear on a daily basis from the people that I work with is frightening. So many survivors reported having their targeted parent being accused of false allegations in court that included domestic violence and child sexual abuse aimed at them. Survivors in these studies reported that false allegations that involved them were not true. And when the community found out, they were known as the children whose parents had raped or beaten them. This rumor has followed them into their adult lives, and their parents are still known as pedophiles and child abusers. Let's think for one moment, because the amount of false allegations going on in the family court system is very high. And I'm sure Dr. Childress could actually give a really good figure on that. It's frightening. So to imagine to have your parent accused of that, sometimes, sure, it's true, but the majority of the time in family court, it's been shown to not be true. So following onto a different tact, 30% of the participants had also been abducted by their alienating parent. So 30% of the people that I interviewed had been abducted. That's very high. And one survivor explained that their parent had threatened suicide to control their behavior. And there were 10 separate incidents were mentioned during the interview. For example, one survivor asked his mother 2 years in a row if he could call his father at ages 12 and 13. Her reaction the first year was to set herself on fire in the kitchen. And the following year, she ran into the snow naked and lay down on the train tracks in front of an oncoming train. So you can get the picture here. If we have adult children who are being abducted and psychologically abused, this is the parent that they're living with. And when people say to me, "Oh, Alyse, do you think that children who have been abducted internationally should be brought home?" I say, this is why they should be brought home. So now I'm going to look at the findings from study 2, which was the mental health practitioners. So this was very interesting. The MHPs cared deeply about the survivors and adapt their treatment delivery intuitively. MHPs are treating SPA survivors even though there is an absence of clear treatment guidelines. Now, the study results reported 72 recommended specialty subjects and topics undertaken by the mental health practitioners to work with adult child survivors. So as a practitioner, these 10 of the best in the world are suggesting 72 recommended specialty subjects. And considering this wasn't even mentioned to me, this topic, when I was in university doing my master's, like, it just makes you think, how are these kids going to get the support that they need? The mental health practitioners, the best in the world, they're all doing their best, but they suggested 72 different subjects. That's a lot of subjects for us to learn in professional development. So we need to really be looking at, how do we train mental health practitioners? How do we put money into this? So only 5 subjects were repeated. So, and another 66 suggestions were only mentioned once, showing that the MHPs need the development of a treatment protocol to follow. These results validated the second aim of these studies, which was to investigate whether MHPs know which treatment to use as survivors, with survivors. So these studies also reveal that MHPs are not adhering to boundaries of competence. For example, in Standard 2.01, psychologists must have or must obtain the training, experience, consultation, or supervision necessary to ensure the competence of their services, or they must make appropriate referrals, which has never happened in my case. Furthermore, MHPs are not adhering to maintaining competence. For example, in Standard 2.03, psychologists must undertake ongoing efforts to develop and maintain their competence. Not maintaining the previous standards leaves practitioners vulnerable to professional, legal, and ethical repercussions, disciplinary action, revocation of licenses, fines, civil lawsuits, criminal charges, vicarious trauma, and burnout. So practitioners are not receiving the required support from their clinical supervisors either. Their supervisors are not trained in SPA and are traumatized by the MHP mentees' stories, and in some instances have asked the MHP mentee to find someone else. So we've got a lot of trouble on our hands, basically. So, and 20% of the MHPs reported plagiarism among the PA professionals as well. So, and then 50% of the MHPs reported that PA is a dangerous area to work in professionally. For example, bullying and violence is aimed at MHPs by other PA experts. So, on a different tact, high levels of self-directed training and expertise in SPA was also recorded. Barriers to treatment include stigma, a lack of community awareness for the MHPs, and inadequate funding for SPA mental health services. They were all noted. And then 40% of the MHPs reported public arguments and defamation between other PA professionals. And interestingly, 50% of the MHPs in the study self-identified as therapists with lived experience. That's what TLE stands for. And referenced the topic of having lived experience 29 times within the coded data. This discovery of therapists identifying as TLEs in the data was exciting because, as explained in MHP Chapter 6 in my book, MHPs who identify as therapists with lived experience are often stigmatized within their collegial groups. And lastly, 83 different examples of physical and psychological challenges among the MHPs were also captured. So this slide here is some of the 83 different examples among the MHPs which occurred when working in the family court and with clients. These were described as feelings of tachycardia, panic attacks, rage towards their client, and nausea from what they had to listen to. So here are some direct extracts from the data. And again, as a trigger warning. Watching older sons dysregulate and being violent to their siblings due to watching their parents fighting. Number 2, I am supporting a judge who's been threatened online. Someone told the judge they would kill him. This is family court, okay? Number 3, and he runs her down. And now these are direct quotes from my research from the mental health practitioners. I just want to say. So, and he runs her down and he kills her as well as the kids in the car. How do I deal with that? PA pushed him over the edge. Number 4, how do you work with people who are accusing the targeted parent of sexual abuse when they're not being sexually abusive towards a child? Number 5, there's no treatment protocol at all. It's a persecutory delusion. You cannot work with it. You cannot challenge it. How do I work with that? There are another 74 references similar to these in my data. So I'll just jump over the biases in the research because I cover potential biases of being an insider researcher, the journal. Now, here we come. How do we put this into practice? So findings from these studies will be used to aid the decisions of family court professionals using journal articles to teach the long-term adverse effects of children, or you can have a look at my books. So these findings will also be used to develop a treatment protocol, which is what I'm doing now. I'm about 80,000 words in, for MHPs to use with survivors of SPA to arrest the intergenerational trauma patterns, alleviate survivor symptoms, and protect the MHPs from vicarious trauma and serious consequences that may arise from operating outside the professional boundaries and competencies due to a lack of training and supervision. So these are the limitations and shortcomings of the research. Basically, we need bigger studies. And so the research has contributed to the SPA field by offering valuable insights into the perspectives and challenges survivors and MHPs face when working together. 2 significant clinical findings: potential, the specific phobia abduction anxiety variant that I built on top of Dr. Childress's variant with, and the identification of potential links between autoimmune disease and cancer among both cohorts provide scientific grounds for further investigation. These studies highlight the significant professional and ethical repercussions that MHPs may face when working with survivors without adequate training, clinical supervision, or a treatment protocol. These studies have identified that a collaborative effort needs to be practiced among MHPs alongside practical, interdisciplinary approaches to enhance patient care and ensure ethical principles guide the delivery of SPA mental health services by fostering open communication, mutual respect, and shared decision-making. MHPs and other professionals can work to provide comprehensive and ethical care to child and adult survivors while not contributing to further harm. So thank you to everyone for watching. And again, thank you to Dawn McCarty for putting together this amazing conference. This is my last slide. Now I'll hand everything back to our MC. And this is a picture of me with my dad. That's him on his 21st birthday. And I was born a couple of years after that. And that's me on the right with him after we reunited about 23 years later. And yeah, that's it. And it's dedicated to my alienated father, whose death is actually still under investigation.
Oh, Dr. Alyse, that was truly, truly incredible and amazing, the amount of data that you've been able to collect. First and foremost, our heartfelt sympathy with respect to you, to your fathers, and to your loss in the trauma that you experience. You have firsthand knowledge and have gone through this in a way that I'm sure has, or possibly, I don't want to speak for you, but has fueled the fire of passion that's in your heart. Yes?
Yeah, totally. Yeah, for sure. And I'm a child of abduction, and
Absolutely.
you don't do that to children. You just don't do it. And anyone who's moving children out of an area where away from a targeted parent, don't do it. Don't do it. You've got to be kidding. And you just read all of the statistics and everything, and I apologize. It's a very, very big twin PhD. There's a lot of data that I collected. I just wanted to show the world that where we don't have the proper treatments and these adult child survivors are really suffering, and we have to do something about it. And that's why Dawn said, let's put on a conference, Alyse. I went, okay.
You had no idea where this was going, but look where we are today. Look at where we are today. And
can I chime in?
Oh,
can I chime into that?
Yes. Hello.
Oh man, you guys are doing so amazing. Thank you so much. I just wanted to chime in and say what a beautiful job you guys are doing, just taking over and making sure the show goes on. I can't tell you how much I love and appreciate you all for doing this. And Alyse, that was fantastic. A great, powerful way to start the day on day one. We have so much more, but yeah, this is, I knew that your research had to be out there, and I kept thinking, and I saw problems at 2 a.m. It's my best time to really, my brain works harder at that point when my body's resting. And that was the solution when I woke up that morning, and I'm like, oh, I got to call Alyse. And I never call Alyse when I wake up because that's usually our off time. But I called her, and so she was a little worried that, why is she calling me now? It must be important. It must be an emergency. So it was quite a morning. I don't think either one of us will ever forget, especially now with the transformation of this conference and how it has been. We've seen some challenges with putting the conference on, especially with this hurricane bearing down on us, but nothing stopping this research and our voices from getting out there. So I'm glad that we were able to make this happen, and nothing has been able to stop us.
That's right. That's right.
Yay, Dawn.
And next
Yeah.
up, we have coming Rachel Roberts is scheduled from 9:10 to 10:10 a.m. this morning, but we have had a complication in that she had to head over to the hospital. And so Rachel will not be on today. She may be on a little bit later this afternoon or possibly tomorrow.
Well, I wanted to know if Alyse would do the honors, if you have Rachel's profile available and handy, if you would do the honors just to let us know a little bit more about Rachel, and hopefully she will be able to join us later today or tomorrow or during a panel. But Alyse, if you're prepared for that, I would love for you to formally, give us a little
Absolutely.
insight on wonderful Rachel.
Yeah, I can put her slide up
That'd
if
be
you would
great.
like.
Do that, and then I can talk about the work she does. Yeah.
Okay, I can do that
Rachel's amazing.
immediately.
Darling Rachel. Rachel is an Indigenous, Aboriginal, First Nations Yinarr woman. She is here in New South Wales in Australia, and she's an educator and behavioural specialist practitioner. She's a horticulturalist. She's got a BA in art history and cinema studies, a BA in English text and writing. Now, Rachel, I just want to point out, is an adult child of severe level parental alienation, and here are all her qualifications. So again, she flies in the face of, we're pretty broken, we don't have good academics, blah blah blah. So here she is, Master of Teaching Secondary History and Aboriginal Studies, English Literature, Music, Visual Arts, Master of Education, Special Ed, Emotional Disturbance and Behaviour Disorders. Done mini thesis on the effects of pharmaceuticals versus therapy on boys with ADHD aged 8 to 14 years. Rachel has also been a teacher in special needs behaviour schools in Western Sydney, some of the most difficult populations that we work with on the front line. She's also been an assistant principal and a principal. Now she works for the Department of Education and Training. She's a specialist parental alienation expert on working with children within the system of school system. And she points out that at least 30% of the population, Indigenous population within the schools that she works with, are parentally alienated children. And she's absolutely amazing.
Amazing, and what she has done, what she has accomplished, and look how she's turned her trauma into having a voice for the children and for future generations. I think that is so key right now, to focus on the children. And what we are doing is not only changing thought processes, but changing how we react to accepting this is not in a position where we don't accept it anymore. It's we're standing up, we're having a voice for the children. Dr. Alyse, do you are you able to share a little bit, because you know Rachel, are you able to share just maybe one or two things that maybe happened in her background that she would allow us to hear?
Oh, well, I do know Rachel was kept from her father and her father's family for many years, and then she knew him as a younger child, but then it was made very, very difficult for her to be actually have the father in her life. And then one day, I remember she was telling me the story about, she was asking about her dad, and her mum got her in the car and drove up to a house and said, "Get out, there you go, he lives in there, go in and see him." And she said she had no idea what was going on. She just got out of the car. She's quite young, walked in up to a house, knocked on the door, and apparently her father and her grandmother were there and some other cousins. And they just put their arms around her, were very shocked that she'd turned up, were very shocked and sort of pulled her right in. But from that moment on, she's been in a very difficult relationship with her mother, very difficult, because she aligned with her father and wanted to see him. And a lot of us who do want to have time with our other parent, the alienating parent can make that extremely difficult for us to do, and extremely difficult for us when we go back to the house.
Right.
So
Yeah.
there's a
I think that
whole
whole
lot of
mantra
stuff.
of you need to learn how to hate them because I do too. And if you don't
Correct, Marty.
showcase the test and filth towards them, you're no good to me, you little son of a bitch. And all that attitude towards children, you know, whose brain and emotions have not even been formed or finished yet. I mean, just the decision-making capacity of a human's mind, you know, doesn't really finish the critical decision-making in the front of the skull until around the age of 29 of a human brain does it begin to finally finish its formation. And that is the critical decision-making. And so when you look at other markers, like in the insurance industry of, you know, well, why do they punish males who are unmarried, 25 or younger, so harshly with insurance to drive a motor vehicle or a motor car? And it's because they have an actuary on staff who is doing the data and looking at the incidence of accidents and risk taking and pulling out and speeding and all that other behavior of a lack of decision making that is not properly formed yet. So to throw all that down on kids from a 30 or a 40-year-old or a 50-year-old or whatever, I mean, it in itself is abusive. For parents to weaponize children in this manner is abusive, and they need to be probably held accountable. I know in the United States, it's very interesting to see it's illegal for the failure and lack of paying child support. That is not a legal excuse tolerated under American law for disallowing to be allowed to see the child. So even when a deadbeat, whether it's a man or a woman, typically it's a man, is not paying, and that's just statistics. You know, they're not allowed to restrict seeing the other parent. That's illegal in America. So, and I think it took them a while to figure this type of stuff out too, because kids have been weaponized for so long.
Yeah, and sometimes the deadbeat label is a label given to a targeted parent, and oftentimes they're not deadbeats. They're dads and mums who want to see the children, but they come with a particular narrative, and sometimes they don't want to pay maintenance because they're not allowed to see the children anyway. So it's like there's a lot in that space, a lot. I can't even get into it at the moment. It's so much, but yeah. But
Dr. Alyse, Dr. Alyse,
yeah.
I just want to back up a little bit since Rachel's not here and hopefully she will be able to join us. I wanted to ask a little bit of the history. How did you and Rachel come together? How did you guys have this relationship? And let us know a little bit more. What was the pivotal point of you guys coming together for this beautiful day and cause and all that good stuff?
Okay. Well, Rachel's actually my cousin. So she works in the same field that I do. So we have a lot in common. And it wasn't until we both figured out about parental alienation and I was able to tell her about it that she actually realized what the heck had been going on with her too. So, yeah, we've got a lot in common because we both work in behavior schools and special needs and things like that. So we talk till the cows come home. But she is one of the best out there without a doubt. Yeah, that's how come I know her. Yeah.
And what was the pivotal moment for you or Rachel to take, obviously, because, you know, this affected your life. However, when you decided to do it as a profession, what was that pivotal moment? Did you have any encounters with family? Did you let them know that you were taking this as a lifestyle for work? Or did you keep that quiet because you might have been a little concerned about the pushback?
Oh, yeah. Well, we're as a child of a severe level PA and abduction, pushback is all I've ever known. So we were taken over state lines under different names and weren't we were not even, I wasn't even allowed to see Rachel when I was younger. So it just, we were completely removed. That's all part of a domestic violence. Make it so that you've got no one to rely on. You have to actually rely solely on an alienating parent, because lizard brain, we're wired to our parents. And if we've only got one, lizard brain tells us that if we, don't have them in our lives, we're basically don't have anyone to look after us. So we have to attach to them. It's in our DNA. It's their cult leaders. They're our cult leader. We do whatever they say. We are child soldiers in severe level PA. We do whatever they tell us to, pretty much. And especially after you've been abducted and moved and changed schools and told constantly that your father or someone he knows that I won't even be able to recognize as coming to get us. That's how we lived. So, we just be in the house, and that's what we thought about all the time, who was coming, when they were coming, for years and years and years. So, another argument to get put back with the normal range parents, so to speak. Yeah.
Where did you find, because of these severe, abductions, how did you find a confidant? How did you find somebody to be your alias to help you break free?
No, we didn't have one. It wasn't until I was probably 30 that I even realized what had happened. So, and it was a Catholic nun who came into my life, who just said, "This isn't okay. What's happened to you?" So I'd been to 15 schools as a child too, and I'd been expelled from 3 high schools. I was on a nowhere track, let me tell you. So, it was a miracle that I got out of it. But it was the nun that saved my life, and I still talk to her pretty much most days. She's like my mum to me. So, she's amazing. But then I reunited with my dad after about 23 years when I was about 30. So, and ever since then, I've been the demonized child, like adult child. So it's a hard life. Even after we reunite, it doesn't stop. This level of alienation, it still comes at us. And this is what Dawn and I also work on. What happens when you have to still live a life with an alienating parent and a targeted parent, and you're an adult? And you've got christenings and weddings and all of this still narrative going on, about how terrible they are. And then I lost my dad, and the narrative's still going on about everything about him, how dreadful he was and blah, blah, blah. But he was my best friend up until he died. So after we reunited, we're very alike, very alike. So that's why Dawn and I fight so hard for this cause, because she was abducted as well and didn't see her father for 44 years. And
what about people who have made severe mistakes that were unconscionable and unforgivable, but they went to therapy and have gotten better over 6 to 8 years of long-term therapy with 2 sessions per week that they're socking away 300 per hour on. And 8 years later, the father reemerges and is healed and sorry for what they did, or the mother reemerges and is cognizant and filled with sorrow for what they did. How long are you going? And it's understandable if a child says, "Look, we can talk and we can be friends, and I'll call you my sperm donor, but you're not going to be my dad or my father, and I probably will never forgive you, but I want to have a relationship with you because you seem to have put in the effort." If you've spent 8 years in therapy and whatnot to unwind a whole bunch of issues from your parents and what you went through in Vietnam and whatever the excuse mechanisms are, at what point do you continue to castigate and smear and use shame and blame as coping mechanisms for that individual? At some point, it is rational to think that, maybe that needs to end as well. People can change and seek forgiveness, whether it's given or not.
Yeah, true. And within the parental alienation and child psychological abuse area, as long as the child as long as the child is not being physically or sexually abused. See, we're talking about parents who are safe, loving, and emotionally available, who are targeted. They have they are usually have wonderful relationships with the children, and they love their parents. The children love them. This is a different level of parent than someone who is sexually abusing a child. We have to protect children. So it's a bit of a different argument, but children of alienation, they're poisoned against a parent that they absolutely love, and generally the other parent is wonderful and amazing and loving and safe, and then all of a sudden it can be overnight they can turn on a parent, and that is not normal. And to have a child fear a parent, that's the parental alienation. This pathology is the only one in the world that we see this in. We don't see
Right.
this in anything else, any other child abuse. And even when we are talking about children who have been sexually abused and things like that's a whole different topic for another day. But a lot of the children of sexual abuse that I work with, they love their parent who's been abusing them. They say it. And that's got a whole other lot of stuff going on in there too. They've normalized it. They're used to it, a lot of them, and some of them will never recover from it. And then others who are just, it's just a whole different argument. But parentally alienated children and abducted children, this is a very strange sort of field to work in because it's very specific. So Dr. Childress is actually very, very amazing talking about this too.
I just a couple of things. The first of all, in your talk, you had mentioned the phobia. So it's like, could you expound on that? When a child, is in a situation of parent alienation, what does that do to a child's mind in a separate setting? Let's say in school, if they feel like maybe the same behavior of that alienation is happening with the teacher, can that happen, or is it transferred to other people? Or
Yeah,
what did you mean by
definitely.
phobia?
It can be. Oh, the phobia is generally of the targeted parent. So the phobia that I'm discussing of the under 8-year-olds who have been abducted, that's a very different phobia. That is one that is not real. It's factitious disorder imposed on another, but they're very, very, very phobic. They are terrified of the world. They're taught to be terrified. They're not taught to have voices. So a lot of the research says that they're haughty and arrogant. But this population that I'm talking about who've been abducted, they're not haughty and arrogant. They're abducted kids who are being poisoned on a different level. So they don't have voices, a lot of them. So it's a different kind of variant that I've noticed that I have not seen in any of the research before. So that's what we were talking about. But with regards to schools, the alienating parent will often go in and get the school to align with them. And schools, this is where Rachel comes in. Schools should not be getting involved in these situations. They should not be listening to parents' arguments. They should not be siding with parents. They should only if there's a court order, Rachel says. And because I hear stories all the time, like targeted parents walking in just want to see their children, and all of a sudden the child's running, screaming, and it's just a terrible situation. A lot of the parents can't go into the schools anymore, and the grandparents can't come in either. Grandparents are alienated too, and they miss out on everything because the alienating parent will have false allegations against them or be saying terrible things about them to other people. So they're pariahs in the schoolyard, and they just want to go see their child. So we have a lot of other weaponized parents coming back, telling the alienating parent, the targeted parents there, the teachers will all lock down as well. Like, it's very serious, and they're just listening to all of the delusional stuff that's going on from the alienating parent and believing it all, and they need to wake up to themselves, and that's what this conference is about. We need to understand the mind of an alienating parent. They collect alliances. They collect people, they tell, and you've heard these stories out there about when people split up, about how terrible the ex is and why they want full custody of the children. And you know, sometimes they are terrible, but a lot of the time the kids, they just want to see their parents. They don't want to be involved in any of that
Sure.
crap.
Yeah.
They
Sure.
want
Can I
some
jump
type of
in
normalcy.
and share a little bit too, just to expand on that? One of the things I really want to add to and kind of pull out a little bit is the fear, and Alyse spoke about the fear in her studies, where we actually fear pushing that parent too far. And when we're doing things, even if our parent's not with us, we know that they'll either find out, or maybe we're out in public and we think we're safe, but when we get home, that whole dynamic still exists. So what goes on behind closed doors is really powerful here. And that's why it's really hard for children to speak out, because they don't have an advocate, for one. Their advocate is their targeted parent, but they can't communicate because it's not safe. So when the child is trying to stay connected to that other parent and they realize they're being punished, or that something is being expressed or shared about the other parent that causes, it starts with that little bit of confusion, right? So you start with confusion where the child's thinking, wait, that's not, I don't remember that. But eventually they start to believe the poison. They believe that pathogen. They start believing the stories that they're being told, or at least taking the side of caution where they don't want to risk getting themselves in a place of danger. So it can be very dangerous for a child to take any action against what the alienating parent is doing. And it gets pretty
Yeah.
scary for us.
Because they know the repercussions, and they feel
They
the
will pay
words.
for it. Yeah, they will pay for it.
They'll pay for it.
And the phobia can last well into adulthood, right, Dawn?
Exactly. Yeah, it does. I can attest that the phobia does last, especially when you're not aware that's what it is. So this conference is really about the awareness of not just an action of a parent. This is awareness about yourself, internally, what has happened to other adult survivors, so that their awareness can be expanded on their experiences that they don't even realize that they're experiencing. But maybe we can help people connect some dots and put
That's
things
right.
together.
That's
Yep.
right. That's
Yep.
right. Joanna or Joanna, depending on your accent, Pappas is now on with us. Joanna, go ahead.
Welcome,
Yes.
Joanna.
Hello. Thank you for this conference. It's really an honor to be here. So I'm a targeted parent, and I was listening to you, and there were no other adults around me who could step in and help the child with the alienating parent, not even the therapist who was validating the child's, let's say, delusions. So what we can do, how to diagnose this factitious disorder? Who should I turn to, a psychiatrist, or what kind of specialist? Because like a regular therapist, the people at school, they were not very helpful, because they were validating what the child was saying, and these were all delusions.
Yes, this is a big problem, and this is what showed up in my research, as you probably heard before, that the mental health practitioners aren't trained to notice this, and the best in the world, even though they know what to do, they're still using 72 different modalities. So we've got to get people trained on the front line to notice when children are experiencing shared delusional disorder and factitious disorder imposed on another. We have to train the mental health practitioners, because they don't know. They think that they're looking at all sorts of other things here, and they're wrong on so many levels. So if you go on to Dr. Childress's website, actually. He has a whole lot of free booklets there that he's made for you to get and give to law professionals or mental health practitioners. And the booklets actually teach the mental health practitioners and law professionals what to do, how to work through it in court. Like, he's got all the resources there. He's made them all. It's just that we've got to get them out into the world.
Beautiful.
Yeah. I know Dr. Childress, and it was very helpful to read about this, because actually I got my custody back, but the child is emotionally damaged, and I don't know what to, I mean, now I have a quite good relationship with my son. I have 50-50 custody, but I was alienated for a long time, and the child is still emotionally damaged. Nobody diagnosed anything, and everybody is saying it's fine now. No, it's not fine. He's still alienated from the grandparents. He doesn't want to go and see them. There is still the problem. I cannot find any therapist. Nothing really truly exists. No diagnosis.
That's right,
no protocol. Yeah.
It doesn't. There is no treatment protocol. That's why I'm writing one. So there is none. That's what my research proved. 100%. There is no protocol. So what do we do when adult children sit in front of us? I've got a great idea, because I am one, and I've sat in front of a lot of psychs who didn't know what the heck to do with me. I can tell you now. I was really, really a very, very difficult adolescent, and made their job very difficult. And I did that on purpose, because I didn't want to be there. They didn't know what they were doing. And there was no point. I'd lost all hope. I had no hope at all that anyone would even notice we'd been abducted or be able to help us in any way. And then anything I told the therapist, they would tell my mother, the students. So I stopped talking. And just was verbally and physically abusive towards them. So that's why I'm writing the protocol, and hopefully when your child sits in front of the practitioners soonish, next couple of years, I hope, if they bother to read it and do the professional development on it. But there's a lot they have to know to be able to work with adult survivors and adolescent and children, a lot. And it's not a quick fix. Send them to a reunification camp for a week. No. Got a long way to go, Anna. I'm so sorry to hear about your child, but we're working as hard as we can. And unfortunately, I don't get any money for writing treatment protocol. It's all done in my spare time. I've still got to work full time, still got to study. There's no money in any of this. So we do it for the love.
Dr. Alyse and Joanne, before we move on to the next segment, I know we still have a few minutes, a little under 10 minutes. I want to ask both of you guys a question. First, I want to ask Joanne. Joanne, so you're saying, in other words, that your child is being, parent alienation. The other parent is doing the psychological damage to your child, where you are now not allowed to see your child. Is this correct?
No, it was in the past, in 2022, 2023. But I was during a very long divorce. I'm from Poland, so divorces last long. And we have like one court seeing each year. And the judge, he knew us. And these false allegations of violence appeared like out of the blue. And he saw that the child is being kept away from me. So she ordered fines. And he started to obey it. So my son came back to 50-50 custody, but he came back damaged, right? And the therapist we were seeing was not helping him. She did not see the delusions. She did not see any of the factitious disorder, nothing like that. But with time, I have now better. Every month it was better. He came aggressive. He was throwing things at me. But now he's like hugging to me. But still, there is a problem because he doesn't want to see the grandparents. So it's maybe because he doesn't have contact with them. They live in another city. So there was no, let's say, reunification with them. So there is still damage. There is still a lot of hurt. And I think I know now it's, I think, impossible for him to go to therapy because the therapists don't know what they are doing. But maybe when he's an adult, it will be more developed. We have the first conference now. Great. I'm really happy that this is happening and that you're spreading the word and you're talking from the perspective of a child, because and I hope that when he's an adult, he will find the right therapist for himself.
Okay, so
Yeah, and
again,
there
I'm
are
going to go
some
over to.
therapists who know what they're doing, but they're few and far between.
So Joanne, I just, are you finding hope in this conference? And then I'm going to ask Dr. Alyse if she could share that free information, the SEMPI stuff that you might be able to find and download it on a website. It's a resource, Joanne, that Dr. Alyse provides across the world, and it's become well known. And it's a way to approach that conversation. And again, I'm not a doctor. I'm certified in other areas. However, this conversation is so rich. I'm finding hope for you. So I hope that you're feeling the hope as well. Can you confirm that, or are you, because I'm happy that you found us. And Dr. Alyse does have other resources of questions that you could ask. And I believe Dr. Alyse could express that a little bit better.
Yeah, so the Senpai social communication model, it's SEMPI. So it's just basically it's a communication model that I've written. If you ask someone, are you okay? And they say no. So we teach people how to have deeper level conversations. It's a free module. It's right across the whole world. It's an altruistic, reciprocal, pay it forward model. We use it with the children. We use it with the adults. You can go on and have a look. I'm going to have a talk about it at a different time during the conference, but it's basically www.sempisenpai.net. You can go and have a look there, and it's free. So it's just getting out to all the communities. We're teaching the community members how to be first responders if someone's not okay. But the children, we teach the children this model. It gives them a deeper language to use, and then they can ask you the questions as well. So there's the power balance evens out. So, but I'll go into it more at a different time. But yeah, because I think there's our special guest coming on soon, I think.
Yeah, our special guest, RB, I am not sure if they, for protective reasons, they're using a different name. But I was hoping to hear from Dawn. And before we do that, we also will have a break for everybody with some peaceful music. And then we do have scheduled today at 10:10, which is 2 minutes, is what we call a book plug for the book that was recently published. Did anybody have anything else? Joanna, I'm going to go on ahead and just step you down, if that's okay, back into the audience. And I see, yep, boop, there we go, like that. So thank you so much to her and all that she's been through, and all that everybody honestly has been through in these regards, whatever it was. Everyone is different and has a different story, and it was not easy for anybody, no matter what you went through. No one is minimized. Everyone is essential, and everyone is important. And I think hearing that in the world, especially from men who predominantly rape, I think it's 96% of rapes are committed by males. But hearing that from men also is very important for a lot of people, to know that you are loved, and that there is so much love out here from everybody. I think this week, I asked everybody on this board that loves me to please place your heart next to mine. And the last time I checked on that board at Rotary International, there was like at least 20, 25 hearts next to mine. And I just felt so good. And it really did make a difference for me this week. So I think also Miss Brandy Rolark has joined us. Brandy, how are you today?
Hi, I'm doing really well. Hi.
Hello, Brandy.
Hi.
You've got your beautiful background ready. How was it getting
Yes.
that uploaded?
It was fine, and I uploaded a preloaded video on Dropbox because I had family court and I wasn't sure if I was gonna be able to make it live. So
Gosh.
but I'm here. We're
Okay.
we're
Love
going
it.
strong.
We love it.
And I see Brandy is scheduled for 11:30 to 12 today, from alienation to empowerment. So this is going to be pretty exciting, beyond beautiful beginnings. Let me put on some peaceful music for everybody as we take an intermission for a second. I know there's been several requests here privately. Could we have a little tranquility music or something? Folks want to go grab a piece of cheese, somebody said. There's somebody else that has a chicken pot pie waiting for them in a microwave. And still yet, I received a private message here. I actually need to use the restroom. So understood. Thank you to everybody for those promptings. With that in mind, we'll just take a short little 8-minute break, and we'll be right back with you. Please enjoy the tranquil nature. We'll make this full screen of the deep healing music. And we talked a lot about this also with the conference. God bless us that we were not there. We were planning on going down. Everything was ready on the island, and we would have been destroyed and evacuating ourselves. But we did talk about having like tranquility music, metaphysical things, candles we discussed, infusers with the beautiful smells and things, wind chimes, musical instruments. We discussed having a sound bath that you could attend at the conference. I think maybe we'll see some of these things next year in Australia.
Let's not forget yoga.
Yoga, absolutely.
Yes.
Dr. Alyse Price-Tobler has completed 2 twin PhD studies. The first is called Working with Adult Child Survivors of Severe Parental Alienation Abuse, Survivors and Mental Health Practitioners' Perspectives. This delves into the complex challenges regarding current treatments within this field. She conducted a thorough international study involving interviews with adult child survivors of severe psychological abuse and 10 of the world's foremost expert mental health practitioners specializing in severe parental alienation and abduction. Her efforts have culminated in developing an innovative, soon-to-be-published treatment protocol. Dr. Alyse has decided to share her PhD studies with the world by publishing them in books. This way, anybody can access her studies and use them toward improving upon and developing future studies and protocols that will advance her work even further. Book 1 is called Disrupting the Intergenerational Trauma Cycle of High Conflict Divorce. This is a guide for mental health practitioners and adult survivors of child psychological abuse related to severe parental alienation. Book 2 is called Navigating the Maze During Treatment of Adult Survivors of Child Psychological Abuse or Severe Parental Alienation. This is a comprehensive resource guide for mental health practitioners offering insights, strategies, and risk mitigation from a PhD thesis on the challenges faced by practitioners treating adult child survivors. Book 3 is coming soon, which will be the treatment protocol based on her research studies.
You want to talk about some peaceful music? That is some really nice music to listen to. And I think I'm just going to play that more often, just in the background from now on, honestly, and maybe work to that. I mean, yeah, we all need more of that. And I think that's a lot of what we have discussed, is having Pilates, yoga. We talked about doing Tai Chi on the beach down there in Florida. We also discussed angry painting as a vehicle at night, where we would have an expert painter come in, kind of like paint and sip. And if you wanted to do some anger-based painting or an emotional evocative painting that you could take home later, the screens would be provided and paints and everything. And, you know, the expert painter up front, they usually lead things like Starry Night, and we're
Oh, they
painting
do.
Starry Night tonight, but you would be able to
Absolutely.
paint whatever you want to paint. And then we talked about all types of things in the trade show
Oh my gosh.
that came
Yes,
up.
Marty. And
Why wouldn't
even
we have like rocks for sale in the trade show, and candle purveyor, and also people with the stones and the waterfall company with the little tranquil waterfalls? And so this is kind of the direction people have asked, where are you guys heading with this conference? And
oh,
going to
truly.
become, and we're like, we don't know, but these are some of the ideas that have come up towards peacefulness. And when you talk about a sound bath, I mean, those are usually hosted in groovy places where they may have a salt cave, but you go to the sound bath at the music shop, they turn off all the lights and they play for like an hour, you know, Zamfir's flute, they play the wind chimes. I've had them even gong a huge Genghis Khan gong, 2000 US dollar gong, all types of stuff. So I think a lot of opportunities are available there. And I do believe, is it Rebecca Bailey is now going to come on? We'd like to throw it over to you, Dr. Alyse.
Dr. Alyse Price-Tobler has completed twin PhD studies. The first is called Working with Adult Child Survivors of Severe Parental Alienation Abuse, Survivors and Mental Health Practitioners' Perspectives. This delves into the complex challenges regarding current treatments within this field. She conducted a thorough international study involving interviews with adult child survivors of severe psychological abuse and 10 of the world's foremost expert mental health practitioners specializing in severe parental alienation and abduction. Her efforts have culminated in developing an innovative, soon-to-be-published treatment protocol. Dr. Alyse has decided to share her PhD studies with the world by publishing them in books. This way, anybody can access her studies and use them toward improving upon and developing future studies and protocols that will advance her work even further. Book one is called Disrupting the Intergenerational Trauma Cycle of High Conflict Divorce. This is a guide for mental health practitioners and adult survivors of child psychological abuse related to severe parental alienation. Book two is called Navigating the Maze During Treatment of Adult Survivors of Child Psychological Abuse or Severe Parental Alienation. This is a comprehensive resource guide for mental health practitioners offering insights, strategies, and risk mitigation from a PhD thesis on the challenges faced by practitioners treating adult child survivors. Book three is coming soon, which will be the treatment protocol based on her research studies. Book one and book two of this three-set volume are available now in Amazon. Look for the third book to complete the series, The Treatment Protocol, in 2025.
And this book called Warning, Children Are Not Weapons, it is a best-selling international bestseller right now, so that's very exciting. And it's unveiling the hidden truth of child psychological abuse related to parental and family alienation and abduction. And it's written by adult survivors. A lot of these authors are here on the panel today and tomorrow. It's a collection by Dawn McCarty and also contributing authors. I just want to share a little bit more about the book. In a world of invisible wounds of child psychological abuse remains unspoken, this book dares to shed light on a reality many have struggled in the shadow to survive. And warning, children are not weapons, is not only a testament to resilience, but a call for societal change. It brings forth stories of courage, healing, and urgent need for systematic reform. And that's really important because it's not only teaching, it's also giving hope. It's giving hope and a voice. And, this is trailblazing, which is not easy, but it needs to get in the hands of those who are making decisions to these children, which is attorneys and doctors and also parents. Let them rethink. If they're the ones that are the offender, let them rethink. And even the parent, like we had earlier, Joanne, even if you're